Welcome to this tutorial on how to use Liftupp. Liftupp was designed by 4 people, myself, Ben Mason, Colette Barmer and Phil Jimmerson. It has quite a long name, which was all Ben's idea, sorry about that, but for all intents and purposes what it does is help you develop into a dentist. The key thing with Liftupp is it's based around evidence-based practice. In other words, we looked at, from the ground up, all the available pedagogy and designed something to do what it needed to do to make you into a dentist. So you can understand why it does what it does in the way it does, I've put this little wish list icon down on the bottom right hand corner, and as we go through the presentation I'll try and show you the thought processes that we went to try and make it do what it needs to do, so that you understand why staff do things in the way that they are doing them, which is actually very important for your learning process. So the things that I want to cover is really, how do you become a registered dentist? What is it that staff have to collect and see about you to make you become a registered dentist? Want to discuss how do you actually learn a skill and how does Liftupp help you learn that skill? How can we show you your progression? How are you developing so you can use that information to get better? How does all the data that Liftupp collects get used to make decisions about your progression through a program? And when you graduate, how can you use the information that Liftupp has collected to inform your foundation trainers about what you can do and where you need maybe some more assistance? So let's start off with, how do you become registered? So a good way of thinking about it is, what is professional competence? And this is a definition of professional competence that's been around for quite a while. But the key thing is, when I was at dental school, it was really a case of knowing some things and being able to do some things. And provided that you didn't annoy too many professors, upset too many patients, and certainly not take out the wrong tooth, and pass your exams, they'd probably give you a dental degree. Unfortunately, times have changed, or maybe it is fortunately for the patient. And now it's not only just about this knowledge and technical skills, but it's also about your ability to communicate. The values that you hold. Those of you that have heard of the Francis Report and the problems in the Mid-Staffordshire Trust will realise how important having the right values has become in the political arena. It's also about your ability to reflect. And the crucial thing which is underlined is, what do you do every day? Not what did you do with the Class 2 test on the Wednesday and you're doing something different on the Friday. It's about what you do day to day. Because actually professionalism is about the ability to do something at the right level consistently. And that's what we've tried to do with Liftupp. It looks at your ability to do the right skill at the right level consistently well. So what this definition means is, instead of just being having data on 2 domains, which is what I went through and most of your staff will have gone through, the clinical knowledge domain, we also need to know how you are behaving in the professionalism domain, communication domain, and management and leadership domain. And the crucial thing for you to realise is, as far as the General Dental Council is concerned, all these 5 domains are equally important. It's no good if you can do a beautiful amalgam carve, but you can't communicate with the patient. So what will happen when you start using Liftupp is, it won't just be an absolute focus on your restorative skills, your oral surgery skills. It's going to be split between these 5 domains. Now, where do these domains come from? Well, they come from this document from the General Dental Council called Preparing for Practice. And it's actually worthwhile you downloading this from the GDC and having a read, because if you fulfill the outcomes in this document, then they will register you to be a dentist. And it's not about being able to do some of them, it's about being able to do all of them. The other thing that has come out from the General Dental Council is another document called Standards for Education. And this tells your dental school and your staff what is expected of them in terms of quality assurance for the programme, to make sure that the General Dental Council is happy enough with your programme to consider it, in their terminology, sufficient, so that they will register you as a dentist. One of the key things in this document, there's a series of standards. Actually, there's 4 standards, and under each standard is a series of requirements. But Standard 3, Requirement 16, basically says that you have to be able to do every outcome, and you have to be assessed in every outcome. Now, this is unprecedented in terms of assessment. If you think about any exam that you have taken previously, it may have been a mix of paediatrics and orthodontics with a little bit of restorative thrown in. You may have decided, well, the ortho is a bit tough, I'll compensate for the orthodontics by doing really well in restorative in the other areas. What this standard is saying is that you can no longer do that. And what your school has to demonstrate is that you can do all of the outcomes independently. So that is a big thing for you to understand when you're trying to progress as a dentist. With the systems that we've brought in with Liftupp, you're actually going to have to demonstrate that you can do each and everything that you are required to do. So there is no point in getting very upset and saying, but I can do A if you can't do B, C and D. So you need to be very professional about this and understand that it's not the staff being awkward, it's what your regulator requires. So the first thing on our wish list that we have to be able to do with Liftupp is we have to be able to track all the outcomes in all of the 5 domains. So your task when you start seeing the data is not just to concentrate on one domain, it's to see how you're developing in all 5 of them. So that's what you need to do to become a registered dentist, is basically fulfill the outcomes that the General Dental Council require at the level they require. So let's think about how you actually learn a new skill. How do you do that? Well, I think the best analogy, and certainly the thought process as we went through when we designed Liftupp, was the driving test. So in the driving test, there is observation followed by feedback. So your instructor will observe what you do, and then there will be a checklist if you like, and there will be some feedback about how you actually have done and what it is that you need to develop to enable you to actually pass the test. And the driving test is a very, very good example of learning a skill, because for any test you have to consider its exact purpose. So for example, when I went through dental school, it was more about writing essays than actually in many ways doing dentistry. Our finals exam consisted of essays and some patients. So what is a better test is actually testing someone's ability to do the thing that you want them to do, i.e. if you want them to drive a car, you put them in the car. The other thing you have to make sure with any test that you do is that it is aligned to the purpose and it's in the context of the purpose. We treat patients in the clinic, so the best place to develop someone's skill and give them feedback is in the clinic. We also have to think about what level. So you have to think about, well, what would a 3rd year be able to do? What would a 4th year be able to do? What would a 5th year be able to do? But all the time you need to know where you are going. So if you're a 3rd year, you need to know where you are in relation to where you need to be, i.e. the 5th year level of skill. Some of you may find that you're already there if you are indeed in the 3rd year. And the other thing that we need to know about a test is, what does it mean you can do if you pass the test? So if I go back to when I was at dental school, the essay. What did passing the essay mean I could do? If I was writing an essay in endodontics, does it mean I can do endodontics, or does it mean I know about endodontics? So one of the things that we've tried to do with Liftupp is make sure that actually the data that comes in gives you exact information that is contextual and aligned to the exact purpose, so the interpretation of what you can do is very, very clear. So the traditional way of teaching a skill is the tell, show and do. So someone will tell you how to do it, they will show you how to do it, and then you do it. Because what we know is if you do that, then eventually you will understand. So the father of thinking about how to do competency-based education in dentistry was this gentleman, Professor Chambers. And he based his descriptions on the concept of mastery. And in mastery, essentially, the more you do, the better you get. It's quite a simple idea. And, practice makes perfect. We all are familiar with that concept. And within mastery, there are a number of stages. There is novice, becoming competent, and competent. And what mastery says is it actually takes you about 10 years to become an expert, because the additional stages are proficiency and expert. So what Chambers said was, in dentistry, the best you're ever going to do in 5 years is to become competent in some areas. And what happened was, because that it is very, very difficult to triangulate lots of data on paper, the simplest thing to do was to count. And what happened is, in dentistry, that people started coming up with a minimum number of numbers of things that you had to do that would predict that you were competent. However, in reality, this is quite, in my opinion at least, quite a flawed way of doing things. So let me tell you when I was a student. When I was a student, you had to do 50 fillings. Once you'd done 50, all was well. And in fact, what happened was, the first 10 you did, you were a novice, and suddenly by magic at number 11 you were becoming competent, then suddenly at number 21 you were competent. Now, I was quite good at gaming things, so I tried to find patients that needed lots of class 5s. And in fact, on one patient, I put the same filling in 5 times on the same tooth. It gave me 5 requirements, but were they measuring competency or were they measuring my incompetence? So the real problem with numbers is that all they tell you is how many you've done. They tell you nothing about your skill level, they tell you nothing about how well you do it, and most importantly, they tell you nothing about how consistently you do it. Nor do numbers give you useful feedback on what it is that you need to improve. So with Liftupp, we moved away from numbers to a concept of enhancing performance. And the person that came up with that idea was a gentleman called Ericsson. And what Ericsson said was, nobody becomes an outstanding professional without experience. So you have to do some. But extensive experience does not invariably lead people to become experts. Think about driving. What the data would show, after about 35 hours of driving, most people can manage a car and drive relatively safely. But what would happen if you put that person in a Formula 1 car? Well, you know what would happen. They would crash it because they're not an expert driver. And to become expert, you have to actually have the goalposts moved and continually aim to improve. And what Ericsson says is that although everyone in a given domain tends to improve with experience, some will develop faster than others. These individuals will eventually become experts and masters, the ones that continue to improve in the ensuing years. However, most of us reach a stable average level performance, like driving a car, quite quickly, and then never improve, because there's no drive for us to improve. So one of the things that we've built into Liftupp is effectively moving the gateposts to make you improve to the level that you need to be. To do that, though, you've got to have very, very good, precise feedback about what it is that you can't do. So in the car driving analogy, if what you couldn't do was change gear, then what you need to practice is changing gear, not driving many miles in the same gear. So in this context of dentistry, if in, say, in restorative dentistry, in restorations, if what you can't do is put a lining in, then cutting more cavities and doing more fillings isn't going to fix that. What you actually need to do is practice more linings. And to reinforce that concept, think about a tennis player like Roger Federer. If Roger Federer was losing a game because he couldn't return one very precise spun backhand type, then playing more games of tennis isn't going to fix that. What he needs to do is to practice very deliberately the return of that specific spun backhand, and as it is with you in dentistry. So what that means is that the data we collect has to be broken down into the sub-domains of each skill. So for example, with the filling, the isolation, cavity preparation, the lining, etc. So that the data can be triangulated back so you can see which area it is that you need to practice and improve on. And you need to look at that, and it's you that needs to make the improvement. This, on the first view, is quite a complicated diagram, but actually it's very, very simple. What it is a map, effectively, of how you learn during a phantom head session. So let's say we are sitting in phantom head and I am trying to teach you how to do a class 2 restoration. First of all, this would not be a good idea because I'm actually an oral surgeon, but we'll go with the premise. The first thing that's going to happen is I'm going to show you what to do, cut the cavity, etc., and then you are going to go away and have a go. The first thing that you're going to do is you're going to use all the previous knowledge and experience that you have to try and interpret what I've done into something that you are now going to perform. You're then going to have a go at cutting this cavity. And all these things here basically translate to what's going on in your head. So what you'll do is you'll cut the cavity and you'll think, yeah, I think Prof did it like that. Maybe I'll take a little bit more off here. Oh, it's a bit shallow. Yeah, that. And you'll keep going round this very complicated set of thought processes until you've got to the point that you feel it's about right. So you will then look at your performance and think, that's fine. I'm now going to put my hand up and get some feedback from the member of staff. Now what happens next is actually crucial for both you as a learner and the member of staff as the teacher. What some staff will do is they will pick up the cavity, pick up your model, they will look at it, and in their head they'll think, I wouldn't do this in my cat. But what they'd say to you, because they don't want to upset you, because they're all nice people, is, do you know, for a first go, that's not bad. Now this is the ultimate catastrophe in learning, because although it makes you feel better, what it has just done is reinforce to you that all this thought process you went through here is in fact correct. And what you have done is pretty good. And what the member of staff will then say to you is, have another go. What are you going to change? Well, very little, because you're just going to try and refine the thought processes that you've already gone through to try and make it even better. But if those thought processes weren't right in the first place, the outcome isn't going to be any better. In fact, it might be slightly worse. You'll then put your hand up, member of staff will come back, they will look at it, and they will think, this student really isn't very good. But not wanting to upset you, what they'll say is, oh, yeah, keep going. Eventually, though, going round this cycle, the member of staff's patience will wear thin, and suddenly they will tell you that it's no good. And this will come as a great surprise to you, because after all you've been doing is trying to make it better what you did the first time. What needs to happen in these situations is for the member of staff to look at it, still feel, okay, maybe they wouldn't do it in their cat, but what they say to you is, you know, for a first go it's not bad, but you need to sort this out, that's not right, you need to sort that out. Now that might be quite hard for you to take because you want to do well, but you weren't born able to do dentistry, and the only way for you to get better is to embrace that type of feedback and actually incorporate it and change these thought processes. So what that means is, in terms of your development, is you have to get over trying to be perfect all the time, because you're not going to be. You will be eventually, but it's going to take effort and time and thought and lots of feedback from the staff. So Liftupp is about development. It's about telling you through feedback where you are at this point in time and what it is that you need to do to get better. Now surely the outcome eventually will be that you get to the right level. That is the way for you to learn rather than actually someone blowing sunshine at you, you're feeling better, but actually not learning at all. So that is an important thing for you to take on board when going through this process. The staff are going to give you feedback. Everyone wants you to succeed, but you're going to have to go through an iterative process of improvement through embracing the feedback and changing the tactics and thought processes that you use to produce what it is. And that's one of the most important things that I can tell you in this presentation. What else happens when you learn a new skill? Well, there's various levels of a skill. There's this triangle, by the way, is known as Miller's pyramid. But the first thing you need to do in a skill is you need to know about the skill. So that's done with the exams, isn't it? The next thing is, once you can know how, and then you need to demonstrate the skill, and we do that in Phantom Head. And the top of Miller's pyramid is the does. What do you do every day? Now, the crucial thing about this is Liftupp, because it's work-based, is working up here. But also Liftupp has an exam side of it, which is working down here. And the reason that the two elements come together is because currently I find with a lot of students, they know a lot for the exams and they can do a lot on the clinic, but actually they have no idea why they do what they do, because they only actually know it for the exams in the summer, but they've been doing it on the clinic all year. So what's very important is that the knowing and the doing come together in your thought process. So the theory must inform the practice, like that. What else do we need to know about a new skill? Well, some skills are very, very difficult to measure and quantify. This is a wordle of professionalism. And professionalism is one of those very, very difficult things to measure. Because if I went round the audience, I would probably get as many different definitions of professionalism as there are people in the audience. And there is no internationally agreed definition of professionalism. And reference to this wordle for professionalism brings up some things you would expect: patient, honesty, knowledge, respect. But there's some interesting things in here: death, financial, pressure. So there's a vast dichotomy in what people consider professional. So what Liftupp does is it triangulates all the opinions together, and it just says, do you think the student is professional? Yes or no? Well, if 30 members of staff on 40 different occasions say you are professional, then actually you are professional. And that is a great way of getting around some of these barriers. It also gets around problems with each member of staff maybe having a slightly different view on how you should do a task. If all members of staff say you can place the lining, then you can actually place the lining. And that actually is a stronger evidence of placing a lining than having a definition, or a stronger evidence that you are professional than having a definition. It also gets round this triangulation, the problems with staff. Now, actually, there are no real problems with staff. Staff work very, very hard, and they are independent entities that each have to make a judgment on your ability to do something. But triangulating everyone's opinion together gets round the variation that can happen with opinion, which can be a problem if there's only single members of staff observing things. So by looking at everything all of the time by all members of staff and triangulating all their opinions together, if they all say you can do it, then you can do it. The other thing that Liftupp does is it tracks each member's of staff feedback profiles. So we can see who is not giving the best feedback, who is not giving any feedback, etc., etc. And we can use that data, A, to make sure that no bias appears when decisions are being made, because that individual member of staff's data could be ignored for a while. And B, it means that we can use the data to make sure the staff are working as calibrated as is possible. So, when we're thinking about the things that Liftupp has to do, we have to be able to give good observation and feedback. We have to be able to track the areas that you need to improve in. We need to track the amount of type of improvement that you are needed and feed that back to you. We have to ensure that knowing underpins the doing, and we have to be able to triangulate the performance not only of yourselves but also of the staff. So that's how you learn skills, and that's the sort of data that we need to bring together for you to learn skills. So the next question is, how can we actually show you your development? How do we put all these things on the wish list and all these structures together? So this is what we did. This is the structure of Liftupp. So in the middle here is a core. Now what this core is a great big relational database. And what sits in that relational database is all the mapping information for all of the stakeholders. And sticking off this core, we have two assessment systems. First is work-based assessment, but I don't want you to think of it as assessment because it isn't. What it is observation feedback for you to get better. It's just unfortunately referred to work-based assessment. Think of the driving lessons. This is what it is. It's not scores, it's not a test, it's just observation and feedback. The other side of this is the exam database, which some schools may use, some may not. But the schools that choose to use it, effectively what it means is everything that's done on the clinic is triangulated to outcomes in the core, and every question in the exam is triangulated to outcomes in the core, which means that you can have a complete picture from multiple sources of how you are developing in each of the outcomes. On the other side over here is your curriculum, and all the school needs to do is to align where they teach and assess each of the outcomes to the core, and then the curriculum gets bonded in to the whole of the Liftupp process. The exam database I'm going to only consider very briefly, but the key things about it is it follows a very, very strict quality assurance cycle. The key things in this are that each new question is aligned to an outcome or outcomes in the core, so the school has a very, very clear idea of what's being assessed. The other thing is about peer review. Now, for years, I had students come to me at Liverpool saying, "The question's great, Prof, but I need to know who set it, because if I don't know who set it, I don't know what the answer is. Because if it's Fred, then it's answer A. If it's Tom, it's answer B." So what this system has is a peer review process where effectively staff have to take the exam. So they get the question, but they don't get the answers. And it triangulates together how all members of staff answer, and only when they agree does the question get moved on. So it gets around that problem. And then there's mechanisms of standard setting and blueprinting, etc., which you don't need to worry about. The key thing is that the system gives you automated feedback, and what it does is against each of the learning outcomes it tells you how well you did. Now what it doesn't ever do is give you the answers, and this is another important thing for you to take on board. What an exam is a sample of your knowledge, and no exam is going to test every single thing that you could possibly know about an area. So by sampling, it gives an indication of how well you know an area. So for example, this is real data, so this student got 0 in all the questions on dental pain. I would suggest not knowing about dental pain is not a good idea for a dentist. So what their feedback tells them is they need to go back and look again at the whole of the information on dental pain because they don't know it well enough. And next time an exam is run, it'll be a different sample. So don't expect, if this system is used by your school, to be getting told the answers to the questions, because that's all that's doing is testing how well you can remember the answers to the questions. To be professional and be a dentist, you have to know the information well enough to treat patients. So you should be able to take this sort of feedback, look at the learning resource material and make a change. So let's now move on to the side that you're probably more interested in, which is the iPads and the work-based assessments that will occur on the clinics. Again, I stress it is not assessment. It's just, unfortunately, that's what has become the accepted term. Now, what I'm showing you here is the analog version, because when we first developed this in 2009, iPads did not exist. So we developed it on paper. But if I show you the anatomy of the forms that exist within the system, you will have some understanding of what's happening. So the first thing is, obviously, it needs to know who you are and what you did. Each tutor on your program will have an individual personalized code. We use this to look at how the tutors are giving feedback, because we can look, if the tutors are seeing multiple students, we can see which other tutors have seen those students, and then we can triangulate that data together, use the students as the control, and then we can see how each and every tutor is actually giving the feedback, so we can calibrate. The clinic code is there to give additional context to the information that we are receiving. So, for example, if you're looking at communication with a patient and the clinic code is pediatrics, then we know the context is communication with children. Whereas if it was special care dentistry, it might be communication with carers. So those codes give us much wider information on outcomes because of the context that they deliver. Schools are going to be slightly variable how they do this, but the system was designed to have some form of patient identifier. And it can also handle patient demographic data as well, but this is going to be subject to what each individual NHS trust will allow. But the key thing is that developing as a dentist is not about acquiring numbers of skills. It's actually about managing patients appropriately. And what tends to happen is that people start thinking of the patients as, this is my perio patient, this is my crowns patient, this is my extraction patient. And when that procedure is done, then this patient is no longer useful. So you get rid of them and you get another one. What we want to move to is a culture where actually what you do is manage patients appropriately, and through managing the patients appropriately, you build up the skill set. So what the system is capable of doing is tracking how you are managing your patients, how often you are seeing them, what you are doing with them, and whether that's appropriate or not. It's up to the school to decide how they use that information, but I can tell you at Liverpool that progression is dependent not only on how well you are able consistently to do the skills, but also how you manage your patients appropriately. The other thing that was in here is attendance. On the iPads, the system will know you're supposed to be on the clinic, and the member of staff will make you present. If you're not present, by default you will be absent. The cursor skipped over, but clinical alert, this is an NHS incident, if you like. This would be a situation where we couldn't wait for triangulated data to show there was a developmental problem, there was an issue. So the last time I did one of these was the student that managed to stick me in my right buttock with a 35mm ID needle. It did not impress me, and it was somewhat painful and kind of embarrassing to explain to my wife. So they got a clinical alert for that. What happens with a clinical alert is that the member of staff presses the button on the iPad, a box comes up, they type in the incident, and someone in the school will get emailed, they will bring you in, and they will decide whether it's all done and dusted or you need some further training. It is not a disciplinary thing, it's nothing like that. It's, again, it's all developmental. There's been an acute incident, maybe we need to have additional training. Now on the form, originally we had the term feedback. The whole of this system is about feedback. It is about observation with feedback. The problem was, in 2009, that I found a lot of our students didn't really understand what feedback was. Feedback was telling them they were doing well. Feedback was telling them that it didn't matter, it was okay. Now that is feedback, but actually the best feedback tells you what it is you need to do to improve. It's also the hardest feedback to take because we don't like getting things wrong, but learning anything requires trial and error and iteration. So feedback is what this is about. There is a 6-point scale for Liftupp. I'm going to talk a little bit about that later, but I want you to ignore these because these have gone, basically because they didn't work. On the forms, there was a means of getting written feedback to further enhance the process. Obviously, on paper, we were generating about 80,000 forms a year. Didn't work that well. On the iPad, it works extremely well. So how it will be set up depends on where people put the thresholds, if you like. But at a certain threshold of these developmental indicators, often a 3 for third year, 4 for fourth year, staff will be forced to give some written feedback if you are below that threshold. And then there's just a series of observational judgments that staff make. So if you think you're on a treatment clinic, you're about to put a filling in, you probably come to the member of staff and you present the case, you tell them something about the medical history, you interpret the radiograph, you confirm you'd got consent, you'd maybe justify what equipment you were using, what materials you were about to use. The member of staff may ask you some question about your knowledge base. How did you do the local? What was your infection control like? If any complications arise, could you manage them? How did you communicate with the patient? How did you communicate with a member of staff? What were your notes like? Did they think you were professional? If you were working with a nurse, what did they think of you? What did the patient think of your performance? How was your time management? Were you spending a lot of time just mucking about? And the last one of these is insight. Well, how do you measure that? Well, what will happen is the member of staff will, on the iPad, they will make these decisions as they're watching you, because that's why we developed on a mobile device, press the buttons. And then at the end of the session, they would normally sit down and say, how do you think things went today? And if they were looking at a whole row of ones, which means that basically you can't do it, and they needed to do things for you, and you said, I thought it went really well, then that may show a lack of insight. One of the things that you've got to develop is self-criticism. Well, I need to learn how to do that, I need to do that. That is a positive thing. Actually, self-reflection and self-criticism, identifying where you need to learn, identifying that you have a problem in an area, is a very, very positive thing. It's not something to be embarrassed about, to hide behind, to be ashamed of. The only way you can get better is to be honest with yourself. And this is a measure of your ability, effectively, to analyse your own performance. So don't be ashamed if you've made a mistake. That's fine. What's important is that you identify it and you improve. Now, when we moved on to the iPads, we were able to incorporate a lot more stuff. And these things up here don't really matter, but what these are postgraduate tools for work-based assessment. ADOPS is a direct observed procedure, watching someone do something. And MSF is multi-source feedback. What we did was, we took these tools, disassembled them, and made them into something new for Liftupp. And effectively, when you go into the postgraduate arena, you will recognise aspects of Liftupp because it derives from these tools. We included patient demographics, we included timetables, we included procedural difficulty. Procedural difficulty is there because some things are harder than others. Some patients are less cooperative than others. So it's a means of recording within the system. And actually this was more difficult than a standard class 1 amalgam, for example. We've incorporated all your images so that members of staff know exactly who they are, making sure they've got the right person. And up here are what the descriptors for that 6-point scale are. And what basically I want you to take away is that the numbers are not numbers. It's just computers, iPads being a computer, are better with numbers than text. And also foundation training also uses a 6-point scale. But I don't ever want you to think of these as scores or real numbers. If you look, for example, that a 1 what a 1's telling you is that you're currently unable to meet the outcome with the required quality. You haven't sought help, or you've caused harm. Whereas a 6 is able to meet the outcome independently, exceeding the required quality, but you're still able to get confirmatory advice from the tutor. It's not about being completely on your own. You might want to say, this is what I'm going to do, is that okay? But if you think of these were numbers, that means that 1 6 would compensate for 6 1s. So you could kill 6 patients as long as you did one nice one. So obviously these are not numbers. They can't be added, they can't be subtracted, they can't be divided. What they mean is textual levels of performance, if you like. So what Liftupp is tracking is the amount of assistance that a member of staff needs to give you for you to meet the outcome. Okay? And you can take that feedback, the written feedback and the verbal feedback they've given you, to get to the level that you need to get to. So these are not scores, numbers, exam results or anything. They are developmental indicators giving you feedback about the level of assistance that you have required on that particular task. That is all they are. So please don't start arguing with staff, getting all upset, etc., etc. It's about your development. It's about making you the best that you can be, and that's all it is. So we mix all that together, and then we get the iPad app. And you can see here that we've got some images. These are actually developers. That's an awful picture of me. This is the year of study, absent or present, and these are the judgments that staff are making, and these are the 6-point scales. You'll also notice that some of these items are bolded, some are not. That's just for efficiency, because some clinics are better than others for doing things. So for example, you're going to write more prescriptions in oral medicine than you are in restorative dentistry. So in oral medicine, prescription writing would be bolded. In oral surgery, you're not really going to have justification for materials bolded, whereas you are in restorative. However, they do exist in all the forms, because just occasionally you might put a temporary filling in because you're not done one out taking your tooth out, for example. Now, the key thing is that the system is designed so that the database assembles the data. There's lots of things on the forms. So what happens is a member of staff only records what they see. If they only see 3 things, then they only make feedback over 3 things. That's really crucial. It's not going to capture 100% of what you do, because there's going to be 10 of you on a clinic with a single member of staff. They're not going to see everything. If there are crucial things that they need to see, such as the fit of a crown, a filling, an extraction, then it's up to you to make sure that they see them. But if they haven't seen them, they can't possibly make a judgment about it. The other thing is, as I've explained, they're targeted to clinics. But the database over time, because all staff are looking at all things all of the time, will assemble your developmental profile in all of the areas. You'll have access to your data, and it's really crucial that you look at the data regularly and you can see areas that observations aren't being regularly made in, and make sure that they are. That's your task. This is your development. It's your profile. And of course, it's also tracking how each member of staff is giving the levels of feedback. So when you first log in, you will have a username and a password. The school will issue with these, and when you first log in, you'll be able to change your password. I would recommend that you don't use Internet Explorer as your browser. Internet Explorer has some odd rules. We write the software to be supported by on a PC by Chrome and Firefox are very good browsers. On a Mac, you could also bring in Safari, Chrome or Firefox as well. But avoid Internet Explorer. It will work with the later versions, but it is a bit of an awkward browser for people to program for. So you put your username in, you'd log in. Now, I'm going to drop across to my preview student here. So this is roughly what you'll be able to see. What you have here are updates about what the interface can now do, so keep up with those. And down here, this email address is a means of you contacting the help desk in Liverpool for any specific questions, and please use them. If you have specific questions, please contact the help desk. Up here we have the home. Depending what's switched on, you may have timetable, and you can check your timetable. So for this student here, I have no idea who they are because it's picked one of our final year students at random. You would be able to hover over a date and you'd see the clinic. This was a restorative clinic. This is Mr. Harden, who's one of our tutors, and these would be the students that Mr. Harden had on that clinic at that time, and you would be one of them. You can also check your data. Now, how Liftupp organises things is all the forms that are on the iPads get automatically sorted out the data into domains. First thing to show you is this slide bar. This allows you to select a time period from a single day, a week, month, whatever, and you can slide those periods around, or you can pick entire years of study. All data is what it says, it's all of the data. Here are the domains, and what you have over here are the developmental need indicators 1, 2, 3, 4, 5, 6, and we've color coded them. So effectively, red here means that currently you were unable to do this and member staff had to do it for you. 3 and 4 basically means you needed some assistance, and 5 and 6 means that you were doing it independently. The numbers in here are the number of observations. So this student, by the time they graduated, had about 3,500 observations. So this is a very, very robust data set. What this also means is don't get uptight if one thing's gone wrong at one time. It's going to make no difference. And in fact, for most students, the developmental curve is sinusoidal. There's good days and there's bad days. And actually what the system does is it looks for patterns outside the normal variance. So I would expect you to have good days and bad days, a lot of them. What you can also do is you can get a rough idea of how you're developing. So if we have a look when this individual was a third year, you can see that predominantly they were needing assistance, which is what I would expect, i.e. they're in the blue 3 to 4 region. When they were in the final year, there was a massive shift into independence, which is again what I would expect. But don't expect to be independently in everything, and the school will set the levels for these things. But for example, at Liverpool, I never expect our students in oral surgery, minor oral surgery, to get past the 3-4, i.e. needing assistance. That's the level I will graduate them at. However, a class 1 amalgam, I would expect them to be doing independently. So let's have a look at a little bit more detail. So let's just click all data just for ease. Let's look at communication skills. If we click on communication skills, then you can see the various things that staff have given feedback on: establishing a history, informed consent, communication with the dental team, communication with the tutor, etc. If you were to click on one of these, that will open up, and then you can see every single episode that has occurred, when it occurred, what clinic it was on, which member of staff it was, and what level of support or feedback the member of staff was giving. And a quick flick down will show the transition from needing assistance to independence. And in this profile, whoever this student is, there's the odd red blip. Now this member of staff has said completed scale and polish before doing pocket chart. They felt that meant that the student required, was unable to complete the task. It will be up to the panel to decide whether actually that is reasonable or not, but that's the sort of thing that's there. But the key thing is you can also see the written feedback's there. It's there for you, and it's also there for any progression panels that want to make decisions on things and whether they actually feel that that decision was valid or not in the first place. So there's a lot of checks and balances here. You can navigate back to other domains. So let's have a look in clinical skills. Down here are the various diagnoses that the students made on clinics where the diagnosis engine has been switched on for them. But let's have a look in adult dentistry, and let's have a look at direct restorations. I'm just going to zoom out a little bit. So what you have here is how Liftupp classically handles data. It splits it into skills up here and experience down here. So let's have a look at the experience. This obviously is the mouth within quadrants. So I can see that this student has done anterior teeth in the uppers, posterior teeth, and I can even look at what happened at the level of each and every tooth. Over here it shows me the tooth surfaces and the types of activities that have been going on. Here are the materials and the number of completed teeth of those materials. This is difficulty, basic and complex. The reason there's only one here is because this was something we developed quite recently. And here is the patient demographic. So we can see that this student has done at this stage 81 different fillings, or 81 procedures on 18 different patients. So from an experience point of view, you can make quite good decisions on whether the experience is good enough. Up here are the basic skill stages for doing a filling: appropriate moisture control, management of caries, management of the pulp, material handling, tooth preparation, tooth contour and anatomy, occlusion, and whether there was any iatrogenic damage. And we can then, just as we did before, look at any specific stage, open that up, and we can see which teeth, which member of staff, which patient, what procedure, what level of performance. So you can use this data to identify where within the minor supporting competencies for putting a direct restoration in, you need to practice and focus. You also notice that in Liverpool we use this in Phantom Head, and the same things apply in Phantom Head. So when you get this, you can go around this interface and have a good look. Any clinical alerts that you have would appear here, and this student doesn't have any. And on the graduation, you'll also get your portfolio, which you can take to foundation training, which basically shows the areas where you've exceeded beginner level, meet safe beginner level, close support needed, number of observations, breakdown of your experience, etc., etc., etc. So you can take that to your foundation trainer and use that as a dialogue moving forward and moving on. The other thing is, of course, remember it's a competitive market, so your portfolios will matter. Over on this side you have controls about your account, and then there's some information here about using Liftupp. This presentation will be on there eventually as well. Liftupp forms allow you to see all the forms that are on the iPads. So for example, CDF treatment, these are the levels, the 1 to 6. These are the questions, and this is the description. This is what members of staff are making decisions on. So it's worth your while looking at these forms to be very, very clear what it is that members of staff are looking for. If I go to something like the restorative form, then you'll see that these areas here are a different colour. If direct restorations is a good example. So you'll remember that the screen for direct restorations was split into skills and experience. Well, this is where it does the experience count, i.e. the member of staff has to make a decision on appropriate restoration, tooth contour and anatomy for it to appear in your experience band underneath. And that's the point of finish. So you need to be quite aware in these forms of where these areas, these key areas for experience are, to make sure that on sign out on the iPad you check if you finished a restoration on that day that the member of staff has actually given you feedback on that particular area, because if they haven't, it will not appear in your experience down below. It's a computer, it has to make a count somewhere. So what I hope I've shown you is that bringing all this together and having this sort of an interface means that Liftupp can track the outcomes of 5 domains. It makes sure that the observation feedback is reported to you, the areas that you need to improve are highlighted, the amount of improvement is indicated to you through the level of developmental indicator. The knowledge underpins the doing, because part of the process on the clinic is making sure that you have the knowledge and that all the data from all the staff is triangulated together, and also the data from the staff is triangulated so we can see the staff performance. So how are progression decisions made for you using the data? Because I've said this is observation feedback, not assessment. So how is the data used to actually see how well you are doing? Well, Liftupp doesn't actually plot graphs currently, but what I've done is I've taken some data from some of our students in restorative dentistry. So these are third year students, and I've basically just looked at their performance against the threshold. So what we've decided for our third years is that in restorative dentistry, for direct restorations, you should be working at the level of support of a 3 or better, i.e. you will need some assistance, but certainly you shouldn't be in a position where you can't do it. Here, this blue light, well, turquoise bar is that threshold, and these are the number of clinical sessions. Okay, so let's have a look at this student who is in orange. You can see there's some wavering in performance. At some point they do drop below that threshold, but that's their curve. I would say that the student's pretty good. So what the panel is looking for is, has all the observation feedback allowed you to develop a consistent level of performance to that threshold in that time? And if the answer is yes, then the panel should let you progress. If the answer is no, then actually what you need is more driving lessons, and you need to do some more until you can get to that level, because there's no point in progressing from third year to fourth year if you can't actually do the level expected of you in third year consistently. Hope that makes sense. So the orange student would have no problem. Neither would this student represented by the purple. What about our student represented by the red? Now this is an interesting dilemma, isn't it? Because by session 40 they seem to be alright. However, they are curving down again. Now the panel at Liverpool decided that this student actually would benefit from resitting the year. Basically because they can't maintain their quality and consistency. They're all over the place. They're still struggling to get to an even state with the most basic of restorations. So it's no disgrace for the student. We're not saying they're useless. We're just saying, look, you need more driving lessons. You just need a little bit more time to develop that skill. And if I was to go around an audience of students and ask how many driving lessons people would need to actually pass the test, I reckon it would range from around 8 to a couple of hundred. And this is all it is. It's learning a skill. What about the student in blue? Well, the student in blue did quite well, and then there was a bit of a car crash here. And it turned out that this particular student had a horrible family trauma that they hadn't reported. And that had affected their performance. So we were able, using the big data collections, to actually instigate pastoral support. So you need to be professional enough and realistic enough to look at these progressions, and what you're aiming for is quality and consistency at a level. Not getting 20 fillings done, not trying to talk the member of staff into giving you a better developmental indicator. Because all that's going to happen if you do that, and a member of staff is daft enough to do that, is that you're going to qualify and not able to do something, and someone's going to sue you. So please think about it. How we make decisions is about, is there evidence that you can meet quality consistency at a level and that your pattern development isn't very aberrant from everyone else's? Okay? And by using patterns of development, it takes into account any staff variance as well. Help and support, I indicated to you on the homepage of the interface in the bottom right hand corner. It's Liftupp at live.ac.uk. You can email our help team, they are there to help. So, thank you for listening. The take home messages are that Liftupp is not about assessment, it's about development. It's about monitoring your development, getting you to a series of checkpoints, which happen to be the end of the years, allowing you to progress if you have developed sufficient skills, and giving you help and support to attain them if you have not. It is about observation and feedback. It's triangulating the level of support that a member of staff is needing to give you, and ultimately, through changes in performance, it's monitoring your response to that feedback. So it's the ultimate reflection system. Here's where you were told you have problems, this is what you did about it, and here's the evidence that I can now do it. It does not give grades, scores, or anything else. Please never think of it like that. It is not a system of assessment. For it to work, you must be proactive, looking at your data. You've got to be self-directive, you've got to make the change, and you've got to be professional enough to understand that people are trying to make you the best you can be and not argue over minutiae. Action must be taken when your triangulated data shows that there's an area that you need to address, or there's been a clinical alert that shows that there's been an acute problem. And remember, you're not going to be perfect every time. I showed you on the curves, people wobble. It's about the patterns of performance, not the numbers. 20 fillings that have fallen out do not mean that you can do fillings. Also, the staff won't be perfect every time. Staff have good days, they have bad days. They can be grumpy. They may not give you perfection every time, but it doesn't matter. It's about patterns, not numbers. And they're going to be grumpy with all people over 5 years. Used correctly, and in the ethos it's been designed, you will qualify probably better than safe beginner level, and you will know your strengths and limitations that you can communicate to your trainers, and you'll be absolutely ready for foundation training. If you have any questions, please don't hesitate to email me. I will put my email address at the end, and I hope you enjoy getting the best out of the system. We are also very, very keen on student feedback, so if you have things that you think would improve the system, please email the help desk. We've designed this for you ultimately, the student, the future of the profession. Thank you for listening.